Free markets versus government. Which is better? Stay tuned. Hi, I'm Bob Auden, your host for Libertarian Viewpoint. Libertarians believe in liberty, freedom tempered by human rights. How could anyone have a problem with that? This show gives you, the viewer, the non-government liberty solutions the media refuses to tell you about. Then you can see for yourself what the best choices are. The following is a speech by Twila Brase on Obamacare or the Affordable Care Act at the Libertarian Party of Minnesota State Convention. This is followed by a 7-minute video from ReasonTV on YouTube on how simply allowing competition in healthcare reduces its cost. Remember, ReasonTV also has many other thought-provoking videos on their YouTube channel.
Thank you for that kind introduction, and thank you for inviting me to be here at your convention. It's good to see a lot of faces. I was saying that it was probably really nice that it wasn't really sunny today. Given that the information that you're going to get is so important, but the outside is where we're all wanting to be and haven't been able to get out there. So our organization is a nonprofit, Citizens Council for Health Freedom. We started in Minnesota. We do a lot at the Minnesota legislature, but also have a national presence, going to Congress and talking about things like Obamacare, which are going to impact not only the Minnesota, but also the country. And so we do have a national radio program. It's just a minute. It's the Health Freedom Minute. And it is heard every day around the country and 2 times a week on the Patriot here in Minnesota. What you're going to get, what I'm going to talk about today is Obamacare. I'm also going to mention a few things about what's happening at the legislature. And then I'm going to mention our 5C solution for healthcare, in the hopes that that might give you some hope for the future in healthcare, despite how grim it might happen to look at this very moment. So, first of all, Obamacare is many things. It is a 2,700-page bill. Now, I have in my office, I have the 900-page version of it. So the 900-page version of it is about this high. Now, when it came to Congress and they had to vote on it, it was the 2,700-page version, which I think is kind of handy because that's 3 times this height. So this is the bill that they did not read. And logically speaking, nobody could read that in the amount of time that they were asked to vote on it. But after the bill was passed, we've had countless numbers of regulations. So how many of you have seen Senator Mitch McConnell's stack? Anyone? Okay, not so many. So Senator Mitch McConnell did a wonderful thing. He had his staff go and get all the regulations and print all the regulations. So right now, all the regulations, which are not completed yet, are 7 feet high. They weigh 300 pounds. And he's got them on a dolly with a red tape, got it, red tape? With a red tape around them. And he's been taking it to events and press conferences and hearings and all sorts of things. So what we have here is a 2,700-page bill and 20,000 plus pages of regulations. All of this meant to control healthcare in the country. And I venture to say that nobody will have read all 20,000 pages of regulations, and very few people have even read the 2,700 pages of the law itself. So what we have is a massive bureaucracy here, a massive amount of control. You will not have any idea whether anybody is actually following the law or what the law is, because I just want to know how many of you can read 20,000 pages and then make sure that you're following.
Who wrote it? Who wrote it?
The 27,000 pages of the bill were written by staff with input from, we understand, the Center for American Progress, but I'm certain it's not verified. But the fact of the matter is it comes out under somebody's name. So it comes out under a member's name. And then the regulations have been written by the Office of Personnel Management, the IRS, the Department of Health and Human Services, and one I'm forgetting. I'm forgetting one. Well, but anyway, so it's all these different regulatory agencies that have been putting out this information. Okay, so what exactly is in the law and the rules? And the rules, of course, for those of you who don't understand rules versus law, I just want to make sure it's clear. A law is what Congress passes, and then oftentimes in a law they will say, and we give rulemaking authority to the Department of Health and Human Services. So that, for instance, if the law said all Americans must have a red mailbox, then the rules would come out and they would tell you exactly what red means. Okay? You'd get an actual color code to say between this and that, or this one color is what classifies as red, and it would also tell you how often you had to repaint it, how many enforcers there would be, who you had to report to, did you have to send a picture of it, all of that kind of thing. That's making the rules around the one law. So that's the difference between the law and the rules. So what exactly is in the law and the rules? So just as a really brief thing, because I want to get to the Obamacare exchanges, because it's the key thing that we're working on. There's 159 bureaucracies. There's 20 taxes. There's 2 so-called death panels. One of them is much more of a death panel in the way it's been thought of, rationing. Then the other one is, one will do research, which will help to push rationing. The other is allowed to constrain spending on Medicare, which of course will help to push rationing on the other end. And they will use the research in the one panel to help their decisions of what they will pay for and what they won't. There are prevention and wellness pieces, which sound fine, but what you have to understand, if you have an employer who is now asking you to do things like share your blood pressure, get weighed, figure out your BMI, fill out a questionnaire. There's actually money in Obamacare to get your employers to do that and report to the federal government. There's the essential health benefits, which is the benefit set that the Department of Health and Human Services can say that every health plan has to have. So every health plan has to have whatever the secretary says they have to have, and she can also exclude things from being paid for. So you see the contraception mandate is one of those things where she has decided that every health plan has to have the contraception mandate and every employer has to offer it. And that's just a little piece of what you can see how detailed this could become if she chose to become that detailed. There's the individual mandate for you to purchase health insurance. There's the employer mandate for your employer to purchase health insurance. There are some limits on that. In other words, if your employer has under 50 employees, full-time employees, your employer is not required to purchase health insurance. A full-time employee under Obamacare is 30 hours or more. And this is why you are seeing around the country fast food restaurants and other restaurants and other companies who are cutting down to 29 hours. Right? I saw a recent one down to 27 hours. Or universities are saying that their adjunct professors can only do so many hours, because it makes a difference whether they're, at that 30-hour rate or above. In addition to that, the employers have penalties. They have a variety of penalties. One, if they're supposed to offer health insurance and they don't. But the other is if any of their employees go to the health insurance exchange, the government exchange, and purchase health insurance on the government exchange. Now, the other thing to say about the mandate to buy insurance for your employees is that it's not just any insurance. It's got to be affordable, and it's got to be the minimum necessary coverage. So you can't just offer whatever you want as an employer. And of course, there are increased costs, and the words that you're hearing now and we've been hearing for a while is sticker shock or rate shock. And we have heard that the increases are going to be anywhere from 30% to 190%, 190% for young men. And it'll vary in different states and it'll vary in different markets, but really they're all talking from the government to the health plans to anybody in policy are using those words, sticker shock. And they're very concerned that you will choose instead to pay the penalty for not being insured rather than pay the high price of being insured. And it's very interesting, their rationale about why this is okay. Because what they say is, well, it's a richer plan. It's better coverage than they've ever had. So of course it's going to be more expensive. But you don't get to choose whether this richer coverage is something that you want. What if you don't want richer coverage? What if you just want a bare bones plan? Because what you're really worried about is catastrophes. You don't get that choice. They don't give you that choice. So they're just trying to make you feel better by saying, well, you get a richer set of benefits. So, you know, of course it's going to cost more. Now I want to get to the exchange, which is there's many more things in the huge bill, right? But I want to talk about the health insurance exchange. U.S. Senator Max Baucus, who several weeks ago expressed in the committee hearing that this was going to be a huge train wreck. He's very concerned. It's going to be a huge train wreck. He also said, not too much longer after that he is not going to run again for re-election. I think he's concerned about the huge train wreck coming, and he's the one that helped to shepherd the bill all the way through Congress. So he said recently that the health insurance exchange is the most important part of Obamacare. The most important part. So it's not even the individual mandate. It's the health insurance exchange. And why would that be? Well, we look at the health insurance exchange as, we've got different terms for it. So we've got the Federal Takeover Center. We've got the Obamacare Implementation Center. To give you an idea of what this really is, and we call it Medicaid for the middle class, the type of health insurance that you're going to get, which is really not insurance, it's actually coverage. So I want to explain to you the three things that a health insurance exchange is, because people are very confused. They're so confused that the government has now come to talking about it as the marketplace, which is, of course, kind of interesting, because now when even the government people start talking about a marketplace, you don't know if they're talking about the exchange or the real marketplace, because they officially call this the marketplace on their website and everything else to try and get the public to believe that this is a place, a marketplace, not the government. But of course, it really is a government entity. So here's the three things that it is. The first thing that it is a website, a URL. And it's a place that you will go to. And in Minnesota, it's now called MinSure. M-I-N-S-U-R-E. And they spent more than $100,000 to come up with that logo and name. And so if you go to MinSure, you will see the Minnesota Health Insurance Exchange. It's probably, I'll just take a little side trip here to just say that only 16 states and the District of Columbia, Washington, D.C., have actually decided to set up their own exchange, which means they have to pay the full freight of it, to pay the full cost. 33 states, have we got my math right there? I think 33 states, 34 states have said, no, we're not going to do it, we'll let the federal government set it up. And of those states, 6 of them have official partnerships with the federal government to set it up, and 7 of them have unofficial, or silent, or stealth, or whatever you want to call it. They are Republican states, except for one, Montana, that have decided to start cooperating quietly with HHS towards the federal health insurance exchange. Okay, so again, the exchange, 3 things. The website, and on the website, when you go to the website, what you will find is a choice between individual or policy coverage. And then within that choice, you're going to find 4 what they call metal levels. So bronze, silver, gold, and platinum. And all those metal levels offer the same coverage, but it's a matter of how much you will be paying out of your pocket, in essence, your deductible, versus how much it's the insurance company, when the insurance company is going to start picking up. So the bronze level, you will pay less for your policy, but more out of your pocket. The platinum level, you will pay more for the policy and less out of your pocket, but it's virtually the same coverage. That's the URL, or that's the website. The website then is connected with a huge super IT structure, or IT superstructure, sorry. And so all of these cyberspace connections with the state government and the federal government. And here's what happens. You go online in your home to MinSure, for instance, and then you press send. And send versus hub. And you have a picture of that right on here. This is sort of the process of how this works. Takes your data to the hub. The hub then goes to all the different federal agencies and gathers data about you. Your citizenship, your social security number, does it match? All this information. Are you on Medicaid, Medicare? All the stuff it gathers on you. And then it goes to the state agencies and it gathers more information on you. And then it comes up with, this is who, all the information they have on you. And then out of this information, do you qualify or do you not qualify for a policy? It's good for you to know that what you are doing is applying to the federal government. You are not applying for health care. On the exchange, you are applying to the federal government. It is a federal application form. The federal government looks at all this information and decides whether or not you can have health insurance and then whether or not you can get subsidies for health insurance. And this is why we call it Medicaid for the middle class. And the funny thing is, about a week ago, I saw a quote from the former CBO director, and he calls it a second Medicaid program, which I thought was very nice because it just ratified me exactly how I was thinking about this. So it's really what we're talking about is expanding Medicaid into the middle class is the exchange. And what you have to understand is they want all of you in. They want every young and healthy person. They want every employee, but they're starting with this small group and they're saying, no, it's only 9% of the population. But it was only 9% of the population. Why did they just have a 3-day conference on the health insurance exchange in Washington, D.C.? This is no small deal. This is the underpinning of the national health care system that they are planning to create. And I think at the beginning it becomes single seller. The only place you'll be able to buy health insurance eventually will be at the exchange, if we allow the exchanges to continue to exist and to succeed. And it is our hope in our organization, it is our drive to shut down the exchanges by shutting down enrollment. The thing they are most afraid about is that you won't come. We don't want you to come. We don't want your employees to come. We want you to realize that this is the federal takeover center, and this is how Obamacare will be imposed upon the country. But if they can't get you to come, they can't financially sustain this entire mechanism. So when you look at this right here, what you really see is a national exchange with 50 portals into the central server called the hub. What we really have going on here is a national exchange. There's no state exchange, there's no real federal exchange. There's just a national exchange with 50 arms, one into every state to control what happens in healthcare. But if they can't keep the arm funded, if they can't sustain these very expensive IT connections, it's unsustainable and it breaks down. And that's what we're hoping for, and that's what we're driving to. And you may have seen our billboard campaign during the Minnesota debate on it, and we have more things in mind. And so if any of you want to help us to get rid of and thwart enrollment, feel free to come talk with me or to give me a call, because that's where we're driving. The one other thing I want to tell you about the exchange, two other things. One is that in that hub, when it gathers all that data, when you apply, there's what's called a federal system of records. Every piece of data on every individual who applies, on every employer, on every employee, contractor, on everyone is going to be what's called the federal system of records, the largest database this country has ever seen. And then the third thing I wanted to tell you, and the third thing about the exchange is the governance board. So the governance board in Minnesota has 7 members. They were just announced on April 3rd. And they are the ones that are going to be deciding what kind of health plans will be on the exchange to buy your Medicaid for the middle class. And they will make other decisions, but they are the ones who are required to implement Obamacare in the state. And so we actually have an amendment for an upcoming bill to kind of try and thwart that a little, or at least have a vote on it.
This is a house of cards.
Yes, it's a house of cards. So, let me see. All I wanted to say, because I know I'm out of time now, is to just say that we have a different vision for healthcare, and we call it the 5C solution. The first C is cash for care. So everything minor and routine should be paid for with cash. The second thing is catastrophic coverage, true catastrophic coverage, perfectly defined contribution. If you have an appendicitis, they hand you a chunk of money. you use it to pay. You're going to have heart surgery, they hand you a chunk of money, you negotiate with the doctor as to who's going to do it, all that sort of thing. The third one is charity. We can never get rid of charity. Healthcare is all about charity. It started as a charitable endeavor. We can never lose it. We can never just go to the business of healthcare and leave cash and everything else in charity behind. The fourth one is confidentiality, because with the data systems, they can grab your data, they can profile you, they can profile your doctor, they can control your doctor. And the last one is compassionate care. The only way we can have the doctor and the patient, the doctor really looking at the patient anymore, is to take out all those regulations, or to at least minimize regulations, minimize paperwork, minimize reporting, so that we have the patient and the doctor working together again. So I leave you with that. I leave you with a petition that's on a completely different subject, taking all your DNA, your health records and everything, creating genetic profiles. That bill is in the conference committee on Monday morning. And that's it. Thank you very much.
June Wisgoski is about to undergo a simple procedure to relieve her carpal tunnel syndrome.
Are you nervous?
A little bit. I think I'm more nervous about being put to sleep.
What makes this routine surgery so unusual is that the total price, which comes to $2,750, is posted online.
We decided we would have price honesty.
Dr. Keith Smith is the anesthesiologist on duty and the co-founder and managing partner here at the Surgery Center of Oklahoma, which is located in Oklahoma City. 3 years ago, Smith and his partner started listing their prices on the Surgery Center's website, a move that would only be considered radical in the healthcare industry.
It makes me mad that a lot of people are bankrupted by our current healthcare system when the costs are many times completely unjustified.
Let's say June Witzkowski had been treated instead at a traditional hospital nearby. Not only would the hospital have charged more than double the Surgery Center's price, since she hasn't met her deductible, Witzkowski would have had to pay the lion's share of the bill herself. At the Surgery Center, the bill was so low that her employer simply covered it. She paid nothing.
I like to think of what is done with all of the dollars that are not spent on healthcare here that would have been spent at one of the big hospitals across town.
Witzkowski ended up at the Surgery Center because she and her employer were directly responsible for paying the bill. If an insurance company was covering it, she would have had no compelling reason not to pick the more expensive option. The Surgery Center is part of a growing phenomenon of patients and companies breaking away from the traditional healthcare industry with its distorted incentives and outrageous prices.
We are done.
As Obamacare drives out what's left of markets in medicine, Americans are increasingly turning to providers like the Surgery Center, which show that it is possible to offer high-quality healthcare at low prices.
It's always been interesting to me that in any other business, tons of research is done into making systems more efficient. But in medicine, somehow or another, that is just completely lost.
Dr. Jason Sigmund regularly performs procedures at both the Surgery Center and at Integris Baptist Medical Center, which is the epitome of a traditional hospital. It's run by Integris Health, which is the largest healthcare provider in Oklahoma, serving over 700,000 patients a year. Sigmund says the Surgery Center is so much more efficient than Integris that he can perform twice as many surgeries there in a single day.
We have pressures to do that because the amount that we get reimbursed for the same case that they do at the hospital is such a fraction that we're really forced to be efficient.
The long-term players in the medical business need to be pushed to a new way of looking at things.
Dr. Stan Baker is chairman of the Ear, Nose, and Throat Department at Integris Hospital. Like Dr. Sigmund, he prefers to do his procedures at the Surgery Center of Oklahoma.
The place is run recognizing the needs of busy surgeons to devote their attention to the important technical details and not have to worry about a lot of other things. And that's what happens here.
Except for the clerical staff, every employee at the Surgery Center is directly involved in patient care. Human resources and building maintenance, those are the responsibility of the head nurse.
One of the main reasons our prices are so low is that we don't have administrators in $3,000 or $4,000 suits running around and vice presidents at every imaginable level.
At Integris Health, the top 18 administrative employees made on average $413,000 in 2010. The wastefulness of traditional hospitals is reflected in the way they bill for their services. We obtained an itemized bill for a procedure performed at Integris Hospital called a complex sinus surgery, which treats chronically infected sinuses. The surgeon was Dr. Jason Sigmund, who also does the procedure at the Surgery Center of Oklahoma, where the total price is $5,885. The bill from Integris comes to more than $33,000, although the actual bill was even higher than that, since unlike the Surgery Center's price, that doesn't cover the surgeon or anesthesiologist anesthesiologist. Integris can get away with charging more than 6 times the surgery center's price because generally its patients don't pay these bills, so there's no real sticker shock. This leads to outrageous markups, such as a $360 charge for a steroid called dexamethasone, which wholesale costs 75 cents, or 3 charges totaling $630 for a painkiller called fentanyl citrate, which costs the hospital $1.50.
They're actually inclined to embrace waste. The more things that are opened up or used at a hospital, the bigger the hospital bill becomes.
Although hospitals rarely collect the full amount printed on the bill, private insurance companies generally pay around 60% of the total, which is still many times what the surgery center charges. Integris justifies its giant bills on the grounds that it loses a lot of money treating patients that don't have any insurance at all. In a statement, Integris said, "It is our mission to treat every patient who enters our facilities regardless of their ability to pay, and so our charges must be set at a level to allow us to recover costs."
You have turned, Mr. President, the right of every American to have access to decent health care into reality for the first time in American history.
Enter Obamacare, which seeks to extend insurance to all Americans so that traditional hospitals can collect money from all their patients. The truth is that this won't do anything to stop exploding healthcare costs, because when the bill goes to the insurance companies or the government, it inevitably looks like this. Only when patients are responsible does the bill look like this. But companies are beginning to revolt against a system that's eating away at their profit margins.
It just didn't feel right when you got a pacemaker bill come in and the charge for that pacemaker was $100,000. It hasn't always been $100,000.
Jay Kempton runs a healthcare administration firm in Oklahoma City that works with companies that pay their employees' healthcare bills directly out of their revenues.
Well, now as we've made it a point to dig under the surface, we're seeing, for instance, that pacemaker may be $9,000, and the rest of that is markup.
He came up with a simple way for his clients to save money. They waive all copays if their employees agree to be treated at the surgery center instead of a traditional hospital.
Shortly after Keith and I started working together, it really kind of dominoed. We've had 4 different facilities in our marketplace have come to us and wanted to be able to have transparent pricing that is for cash paying customers.
Today, the surgery center is doing brisk business, and Smith and his partners are considering expanding.
Now the jig is up, and everyone can see what the prices are here. So it robs individuals who have skimmed off of healthcare dollars. It robs them of their excuse for making sure that patients go to the more expensive places.
We've run out of time. If you agree that vibrant free markets are better than government stagnant control, you might be a libertarian. To find out, take the world's smallest political quiz at www.theadvocates.org. Liberty is always the best choice. If anyone in government can prove otherwise, I challenge them to speak up. To view past shows, go to the Libertarian Viewpoint channel on YouTube. Thanks for watching, and stay tuned for other shows at Libertarian Viewpoint.